How's it going, guys? So we have a special guest over here, a yoga master slash teacher, right? So fill us in. What can we do to help you?
So one of the obvious thing is the left sacroiliac area that constantly bothers. It's not pain, but it's all the time. It's like a constant nagging, draws attention. And often I have to myself pop it and feel a bit okay, but then it will come back and I pop it and come back. And so that's one thing. It's a long ongoing digestive issue. Gas accumulation is one of the problem. The left foot recently, like a left third, fourth, second, like sometimes like some kind of pin or needle, where we put weight.
Show to the viewers over here.
So it's this over here, this area. Sometimes, if I get up, it's like some kind of some hard things stuck and it'll make me jump. I don't know what it is.
So what happens when you do back extension to your neck?
Right now it's less. Before it was just like this. So now it has a bit improved. But then you stiffening parts. It's like the rock part.
Where do you feel the stiffness in the rock part?
It would be more over here and partly at the top atlas region.
Understood. I was saying, because I find this very fascinating. You have some markings in your back. What are these?
That's called tilak. It's a feet of Krishna or Vishnu. So we invoke blessings on 12 different parts of our body. So as you remembering Krishna or Vishnu in India, in other words, God. And we consider body as a temple, so it's also you decorate, like you're putting a spiritual makeup.
Very interesting. Well, thank you for sharing that.
If you understand from acupuncture, it's like a subtle acupuncture that protects, the astral field with that invocation.
That's very cool. Well, thank you for sharing that. Okay, you do have swelling right here. That's what I see here around the sacroiliac joint. Let's test that. Yeah, it's stuck. Yeah. Tender right there, huh?
Yeah.
Most of the pull is right top here.
Yeah.
It's
It's not pain, but it will draw attention.
I do see there's quite a bit of swelling here, and this is just not moving too well. How's that fellow right here?
Not that comfortable.
Well, that's where the problem is already. We found it. Yeah, the second sacral segment's in trouble. Okay, the fourth lumbar's in trouble. Third lumbar's in trouble. And the 11th dorsal's in trouble. Right here, you also got some swelling here too. So you've got the pitting edema right here. There's also muscle spasms here too. Something's jammed up here too. Second dorsal right there. Now let's see what's going on over here, because I see a lot of muscle spasms and swelling all over here. Yeah, let's see what's going on here. This is not, you can tell your body's not happy here at all. See, all of this is not moving. The 7th cervical, that's stuck. 6 is stuck. See, everything else is moving. But 7 and 6, they're both in trouble. So this is what I'm seeing right here. You see there's a little space over here, right? Now this is our sacrum, right? This is supposed to be actually one bone. Now, as when we're first born as a child, right, it comes out in 5 pieces. That's what we call the sacral segments. Now, over time, if there's no trauma to it, it should become one bone. Now, however, there was some kind of trauma in the past. Right? I don't know exactly what you did to it, but clearly it did not fuse right because you still have a rudimentary sacral disc right over there.
Really?
So we tested and confirmed there's a trouble right in there. That's what you mentioned about, oh yeah,
so
that doesn't feel great.
Fused.
Correct.
It
has not fused at all.
And has a disc or it's just empty
There's
space?
still a rudimentary disc space right in there.
Wow.
Right. So that's when we tested and confirmed that second sacral segment over here. When we examined it, yeah, it didn't feel that great over there. It's fixated, it's stuck, and there's swelling all the time on yours. So yes, we do need to correct this. Now, the other 2 components I also want to point out is this. We also have an increased disc space here. We also have a breakdown degenerated disc over here as well. These 2 over here, number 3 and number 4, I can't fix on today's visit because they're just too close to this fellow over here.
Right.
This is something we need to address in a future visit. Now, these nerves over here, it does address the lower intestines. And we'll show that in a moment on the nerve chart over there. But more importantly in your case, is this 11th dorsal. This 11th dorsal also, that nerve innervates the small intestines. And we see evidence of this digestive issue you got going on is this. Normal, I'm going to say like this, should be nice, clear. Okay? But what we see bowel gases all around.
Well, these are all air.
Right.
Oh.
And we also have some constipation over here too. That's what all this buildup of fecal matter is. Right. So we have all this buildup of small intestinal bowel gas and also large intestinal bowel gas. We also see the evidence over here as well. See, this is all in here, and the small intestinal bowel gas is all over here as well. Now, the very top part of it seems to be okay. Right, that's the duodenal part. But everything else, the ileum, all that, that's not functioning as well as it should. Okay. And so the ileum and the jejunum over there, those 2, they're not functioning as well as they should. Now the stomach itself, it seems to be okay because I don't see too much of bowel gas over here. But when we go to the next level, okay, we see this mid-dorsal over here. This one we do need to address because you see how the rest of your spine is starting to curve this way?
Yeah.
Right? The reason why it's curving out that way is because, again, the problem actually started way down here. Foundation first, and these 2 we need to address next to help untwist, get this rotation component out. Right? Now, other component is what I see is this side slip. That's that second dorsal. You're talking about this, I feel like something needs to push forward to get that. That bone right there is, in essence, what we're seeing here on the x-ray is it just simply rotated out so much to the point that this bony part, you rotate out like that. Okay, that's what we're seeing here on the x-ray. See over here, all these bones line up on the side. But when we go like over here, see how much it sticks out over here?
Right.
It's not straight. This is straight, but here it just sticks out. The reason again it sticks out that way is because the bone is shifted over like this. So this is what we call a side slipper. Okay, a side slip. Okay. So how do we address that? Well, we can address that but that's just bottom line, that's a symptom thing. And it won't stay there too long. And I'll be quite frank with you. You probably feel relief maybe a couple of days at most. Or worst case, maybe a few hours. It won't stay put until we address it in here first, right? Now, the next component we do want to discuss, and I'll show a little closer to the viewers over here, is this. Okay. You see this region over here, right? Normal, what we want to see is these rectangle-shaped bones here. But I see this is badly damaged. See how much this bone here is sticking out?
Yeah.
Right? It shouldn't be sticking out that much like this. See this over here? It should be a nice, beautiful rectangle shape like this, but this one is squished. That's number 5, number 6, squished. 7, squished even more. So, but this one over here, the way it's squished is that it's much more, as you see over here, it's much more narrow on the back and taller on the front. So this bone over here, Okay, that got really crushed in.
Uh-huh.
Now, I understand as a yoga practitioner, one of the things that you guys do is do a headstand, right? The problem is, and that's where I would express some caution in your case, this is already traumatically damaged and crushed. Right? We want to try to minimize further crushing. So if there's a way you could minimize and reduce the headstand, it'll be to your benefit because we don't want to lose any more nerve function here. Because this region over here, it's already crushing so to a serious component, to a serious degree where we want to see here normal. We went past this level here, phase 2. We're now approaching phase 3, where as you see over here, there's supposed to be a nice tunnel. The nerve's supposed to come out of this nice tunnel. We're losing that tunnel space.
So it's over here at this stage.
It's getting there.
Oh, I see.
Right here. It's almost there.
Uh-huh.
Okay. So and that's what this is over here. We're like in the transition middle of these two over here. Smack over here, right? You still have this. That's why I still say there is some promise, right? It's just the outcome is just not that phenomenal. Because this is what we call the ball bearing, okay? Nucleus pulsus. This would allow us to pivot and move all directions. And as long as you have this ball bearing, like over here, right? When we realign this, your body can regenerate and repair it. Not 100%, okay? As in other words, we can't get from here to here brand new. It's just not going to happen because there's too much structural damage. But your body can regenerate from here to here, maybe here, okay? But we're talking about a process of somewhere between 15 to 20 years, that long, okay? Because again, the damage is that extensive, right? So to give it a much more better fighting chance to help that fellow regrow back, that's why I do recommend. I'm not saying stop all completely. That's up to your practice in yoga. But I do recommend that we want to try to minimize further damage to this fellow over here. Because once we lose that ball bearing altogether, and when it's completely gone, I can't help that. I have a limit. And that's where we cross that point of no return. Then that's where to a point that no, it has to be surgery only. Right? That's something we want to try to avoid if possible. Right? Okay, let's get the ball rolling on that part.
If you do, let's say, opposite, you work on a bit of extension.
Oh, you mean traction?
Traction.
Right. I understand some yoga practitioners do also do traction. Okay.
Well, in what we do hang upside down. So just the weight of the head, it's just creating space.
It's going to help a little bit, but not as much as you think it would be.
Okay.
Because that's also another common question I get from time to time. So think, Doc, what about those inversion tables? When you put you on a table, they flip you upside down. Okay. So it will kind of work if you're like that for 24/7, right? But let's face it, we're not meant to be having upside down all day long. So the moment we put some weight bearing onto it, just like a deli donut that's been squished, and you try to retract a little bit, let's face it, how much of that jelly donut can be repaired? Not a whole lot. And let's face it, that jelly, all that jelly back in that jelly donut, it's not going to, reflate it completely. No different like a toothpaste, you squeeze out too much, you try to suck a little something back in there, right? It's not going to be perfect. So same story as this. When we do traction, when you hang upside down, even like the gravity-fed traction, can it help a bit? Yes, but very, very slight. It's not as much as we think it is. So the more ideal way is actually, let's realign the bone, get back into proper alignment. The body recognizes, hey, well, this is more stable than it's supposed to be. Then let's start plugging up all these holes. So because that's what happened over here. There's a breach.
Yes.
Your body needs to plug up these breaches. So in essence, just like 25 layers of a finger cut.
That's why I feel like there's some kind of bubble or something.
Correct. That's why we have to address here.
If it keeps coming out.
Right. Because the biomechanical stress you're feeling here actually comes from down here. So that's why we need to address your foundation first. Stabilize and correct this part to get this rotation out. There's just too much of a rotation here. Just like, that's what your body did for here, it just did this. Right. And it's a very, very severe twist. So that's why we're going to twist it from the bottom to get it to here. Right. This is going to take a while. This is not a simple couple visit matter thing. we're talking more than a year to try to address this matter here. And on top of trying to, in the process of trying to rebuild this. Because again, this is going to take a long time, many, many years to rebuild out. Let's go to the nerve chart. So let's clarify what's going on over there. We already identified a couple areas over here. Okay, that 11th dorsal over there. All right. And we also identified these regions over here, the 3rd and 4th lumbar. So this region over here, these nerves, it connects to the colon. Okay. That's what this region is for over here. That's what we identified. But what's going on with the bowel gas and everything else? What we see over here, we have these nerves from the intestines connect over here. So when we start to have a potential issue over here that pinches over the nerve, it can affect the nerve function to the small intestines. And as we already showed out as before, that's what the x-ray showed as proof, okay? The bowel gases, we had it in the ileum and also in the jejunum as well, okay? So the duodenum seems to be okay. That's the very first part. There's three sections of the small intestines.
Ileum and jejunum?
Right. So basically we have these 3 sections of the small intestines. Okay. So the first component of it, 1/3 of it is fine. That's working fine. The second and the third section of the small intestines are not working fine.
I see.
So we are seeing a lot of bowel gases in those areas, and also some constipation in there as well, backed up all the way up to that section as well. No. Splendid. Not the body drop. Okay, drop your shoulders. Last little more. Breathe in. Let's get this side step over here. There we go. Splendid. See if we get a little more out of this fella. There it is. Come on up, please.
Wow. It's like a big load taken off. Yeah. It's only like feels 10 or 20%, you know.
Of what it used to be? So we're saying like 80-90% improvement?
Yeah.
That's great. What other changes you've noticed?
Interesting, the breathing got a lot easier, meaning the depth of the breath for me.
That's very nice. How's that with gases?
Nothing. Don't feel bloating, no bloating.
Well, that was quick. All right. So tell you what, we also want to do a follow-up. So, we'll do a keeping a praise.
Okay.
Let us know our feedback on the next visit, how things are with that bowel gas, right?
Okay.
How's the neck?
Neck, like I was mentioning, it's if someone can push it, because it was, I think, constantly go back and forth, and it was quite stiffness. So right now it's a lot freer and lighter, easy to, and thank you.
Oh, you're very welcome. Okay, have a seat. Let's check everything else.
Yeah.
Let's check that. How do you like that? The center cervical is moving easier. See, do your 6. So I'll tell you what, we're not going to go too overboard with this. We're going to be very conservative with your neck over here.
Okay.
Right? So we're not going to address this. We're going to keep an eye on the future visits. Right?
Okay.
There's another thing we also didn't touch base on. We talked about, you also had a deviated septum in the TMJ, right? Can you fill out our viewers on that one too? What's going on with the TMJ?
I had a full mouth reconstruction in 2012, and then after that, I had a few tooth extractions, and then things started tightening up, Now, when I eat with my right side of the teeth, the inner cheek will bite. So I have to chew most of the time from the left half.
You also mentioned about the deviated septum. You have a little harder breathing to your left.
Yeah, in my school days, I used to play cricket, and I got hit by a cricket ball.
Ouch.
So I think that has caused where the left nostril seems more open, and the right is a bit congested.
Oh, God. The right side's stuck. Okay. So let's work on your TMJ first. Open them out. Close. Open. Close. All right. Open. Close. All right. So that's where your problem is. Okay. Open. Slowly close. Open. Close. Open. Open. No, open. A little wider. Close. There it is. And over here. Open. Close. Open. Close. Okay.
Wow.
Give that a roll. See how you like it.
Interesting.
Well, Phil said, what's interesting?
It's a little subtle, and it puts it back,
You like it, huh?
Yeah.
Okay. Let's see.
I have to
Now,
go and chew and see how that.
all right. Let's see what the nose is doing right now. Yep. That's not moving too well. See, this is jammed on this right hand side. See, it's moving too well. So we're gonna fix that left deviated septum. There we go. Okay, come on up, sir. Give that a roll.
Wow, it opened up the right side.
So this is what I already see here. This talus over here is somewhat compromised, but I'm seeing this first cuneiform. I'm sorry, the first metatarsal and the second cuneiform. I'm gonna take a closer look, see what's going on in there. Now here's the story. Whenever I hear patients, they complain about, oh, we got some pain over here. That's usually from a second cuneiform, and that's what this fellow is right here.
Feels tender.
Oh, it does feel tender right there, huh? Yeah.
Yeah.
So there you go. So we have an inferior second cuneiform we got to address. Talus is decent. Yeah, it is decent. So yeah, first metatarsal is a problem. So we're gonna address the second cuneiform first. Let's see what's going on the right foot. Talus is, yeah. And first metatarsal, yeah. So what we have here, we'll adjust this talus. That's one. Okay. Okay. Flip over. Go. There it is. Now this fella. Now because this is swollen over here, we feel the joint capsule right here. That doesn't feel fun there, huh? So what we're gonna do is we're gonna pump that up first. Sure. Get that fluid out of the way, and then we'll set it. It is pretty badly jammed. There we go. Gotta get this cuboid in there too. Good. Got a part of it. Good, a little more. Okay. Walk around, sir.
Wow. This has a spring action better and lighter. And also this is pretty much, as I said, 90% that the nagging pain got reduced. When it comes to walking, it's this part of the left foot will land. Now it's even pretty much. just it was like I'm just exaggerating, but
Right. You're doing some foot slapping, right? So how's it now?
it's pretty normal. And because this leg tends to feel a bit short, but it's almost lining up.
Yeah, because we rebalanced your foundation there.
Yeah.
Well, that's all it takes, champ.
Well, thank you.
Oh, you're very welcome. All right, we'll see you in the next visit.
Sure. From first visit, my left sacroiliac, it's pretty much gone. The reason I say it is 10% because I feel the left hip joint from the yoga perspective when I do my practice. It feels a little bit locked up. Before it was like all jammed up, you know.
What particular positions you notice that still feels a little locked up?
Forward extension is, so one of the poses, it's this. So this side it's less versus I have more extension on.
Understood.
Yes. So all related to that, you feel like it's something you're holding back, but it's less, but it's there. It seems like it's going away. The gas issue that constantly bothering, it's 70% subsided.
Nice.
Yeah.
Yeah, this thing's jammed up.
Still. Yeah.
How's that fella right there?
Yeah.
How's this one here? Yeah, we gotta adjust that one again. So now we know, based on what the patient's feedback, this 11th dorsal did supply nerve function to the small intestines and I was helping with bowel gas. So we do need to address that again.
Yeah. It's not that much below tender.
Yeah. There's something right there again. Same pose. Got it.
First visit, I felt the left occiput feel more, how do you feel, like bigger or swollen than the right? I don't know how you see it.
Yes, there is. There is. Because your body is trying to compensate, trying to keep your head in a normal alignment as best as it could. Because the way we see in your spine is that, your
Your
spine was curved this way. And it was compensating this way. Because let's face it, if your spine's going like this way, we can't walk this way.
Right.
Right? So what your body did was it kind of twisted and started to go over here, especially in the mid-back. It really kind of twisted quite a bit. And then your head had to compensate going this way. That's why I wouldn't be surprised if you feel a lot of tension and pressure in the very top part and the lower part of your neck there. Okay. Well, just Excellent. Belly drop, belly drop. A little more. Splendid. A little more. A little more. Excellent. Just let it all go. Relax shoulders. Even more. A little more. Just let it go.
How's that nose? How's the breathing?
Breathing is much better.
Mm-hmm.
I would say about 55%.
Excellent. Yeah. Open. Slowly close. Open. Close. Open. Close. Excellent. This one took a little tune up. Close. Close. Open. Close. Close. Splendid. Talus is. Let's get that fellow pumped up. There we go. The cuboid still needs a lot of work. Okay, this one really needs to work. Okay, flip over, please. Not as tender as before.
No.
Okay, so already feeling over here, it's not as swollen. It still needs a little tap. Let's see. So you just need it to be pumped up. We don't even need to set it. But this inferior cuboid is a different story. All right, let's get this fella in place. There's a piece already. There it goes. And let's check what's going on with this fella here. Okay, now we're transitioning to somewhere different. So this is the first metatarsal base. Oh, let's get a little more out of that fella. There we go. All right, walk around, sir.
Oh, this one gone.
So, what's gone? Oh, the right hip?
Yeah. It's relatively interestingly, the right arch lifts up more than the left.
All right, so I'm glad to hear that. Remember, your feet, both of them, are still work in progress.
Yeah.
Because you have to remember from what we discussed last visit, the sacral nerves, there just wasn't enough nerve function going down to both your feet. Right? So it's going to take some time to rebuild both of them. And again, just be a little mindful of some of your yoga positions. It was aggravating that sacral segment. That's why we have to set it again.
Oh.
Right? So I'd be a little weary of doing like extreme rotations and also extreme flexions as well. That's a tendency to knock it out. Right?
Is back bend okay?
Back bend should be okay. You could give that a try and see, if it aggravates anything or what have you. Right? So on the following visit, let's keep it, let's keep track of things, how this is going on for both your sacroiliac joints and your digestion. Right?
Okay.
Okay.
All
It's
right.
been a pleasure.
Thank you.
Oh, you're very welcome.
So the hip is almost 100%.
Uh-huh.
There's no getting caught up in pain or so on and so forth.
That's great. How's the gas?
The gas is almost gone. I'm sure it will 100% will go away. The neck area, the trapezius and shoulder, I would say I feel about over 60% difference.
Okay.
That get tight up. It's getting less and less. So that helps. And because of that, I used to get a little numbness on and off in my left third and fourth toe to the root, from root to the toe. That's slowly going away.
Great.
So interestingly, has improved a bit of a concentration. So
Hey, these are very great progress. Keep in mind, as a recap to the viewers as well, you have a very severe, DJD, degenerated joint disease and disc disease over there. Pretty much the bones are almost touching. So the fact of the matter, you're reporting 60% improvement with that kind of extent of damage, and it's very, very great sign right there. So this is a work in progress, even after the 2 months has passed by. Great progress. We're gonna keep on working on it. Thank you for the updates.
you're welcome.